First of all, let me introduce myself. My name is Mike Gipson. I serve this community as their state assembly member representing the 64th State Assembly District. And I'm also the chair of the Assembly Democratic Caucus. I'm joined here today by members of the healthcare field, service agencies, senior citizens, the millennial community who benefit from the ACA, as we call it, but it's the Affordable Care Act. As you know, the ACA has ensured over 5 million Californians with comprehensive, affordable health care coverage that has been there without being discriminatory against people with pre-existing conditions and allowed them to have more access not only to health care but also to doctors at the same time. Currently in Washington, D.C., members of Congress are working to destroy, to repeal, to take away, to terminate, to do away with the Affordable Care Act. And let me tell you, that is wrong, that is wrong, that is wrong. Let me be clear. The Affordable Care Act has worked for over 20 million plus people across America. And 5 million of those people are right here in the Golden States of California. In my district, the 64th district, nearly 20% of the millennial constituents are insured through Medi-Cal, and roughly 26,000 people ages 65 and older benefit from more than different types of insurance right here in my district. According to Cover California, a repeal of the ACA, any kind of repeal or disruption to the ACA, would lead to long job loss between 200 to 300,000 jobs alone. We cannot afford to have anyone unemployed by the repeal of the ACA. As many of those individuals who will be employed, who will be unemployed, it will be those individuals who are in the healthcare profession. Medical personnel are the ones who will be on the chopping block. Again, this is not the way. This is wrong. This will devastate California, devastate Americans. Let me be clear. The federal government must keep the ACA in full, complete tact. 20 million to 24 million people, lives will be in jeopardy. And let me bring it a little bit closer to home. If the ACA, Congress repeals this act, it would mean potentially 20 to 24 million people that will die. Blood will be on the hands of every member of Congress who votes to repeal this health care act in the United States of America. So with that, we will continue to raise our voice. We will have other call to actions throughout the day with other partners throughout California. We will also take this call to Sacramento on Wednesday, the press conference with other labor leaders, community leaders, etc. We will also be calling Paul Ryan in a few moments and demand that he not repeal the ACA here in the United States of America. Here with me, we have some coalition partners I would like to introduce, and they could do self-introduction. We'll have a representative from the Watts Health Foundation. Please come up and recognize Watts Health Foundation.
Hello there. I'm Roderick Seamster, internist by training and CEO of the Watts Healthcare Corporation. We need to remember that the Affordable Care Act is good. It is good. It is good for patients. It is good for nurses. It is good for doctors. It is good for communities. It is good for jobs. It is good for access to care. We have to remember, prior to the Affordable Care Act, our communities had a tremendous need. The Affordable Care Act put a dent in that need. It developed jobs. It brought the communities closer. And it did the basic thing of life, which is to reduce illness in our communities. So we have to remember, the Affordable Care Act works. We have to remember that it is good. It is good, it is good, it is good. Thank you. Thank you very much.
Thank you. Next, we'll have a representative from Ultimate.
Morning. First of all, I want to thank Assemblymember Mike Gipson for his leadership. Now is the time not to be idle on the sidelines. It's just now the time to advocate for your health. My name is Dr. Erica Hawkes. I am the AVP of Government Relations for Ultimate Health Services. So, Ultimate Health Services is a federally qualified healthcare center serving nearly 300,000 patients since 1969. We're incredibly concerned about the ACA and want to make sure that we're here to stand with Assemblymember Gipson to preserve it. Since the inception of the ACA, the number of patients we've been able to see has tripled by 43% in Medicaid beneficiaries, who for the first time in a long time actually have access to primary preventative care in local communities. In respect to the Assemblymember's district, approximately 12.5 million Californians have enrolled in Medicaid, and just over 60,000 of those individuals live in the 64th district. It's very important. The American Health Care Act would eliminate Medicaid expansion, which means nearly 19% of the constituents in the 64th district would be at risk for losing health care. The ACA has made our community healthier, and by eliminating it, we're definitely focusing on the detriment of our population's health. Because of the Affordable Care Act, we have made steady progress in providing access to care for millions of Californians, and we do not want this progress to be reversed. In addition to providing care to millions of Californians, the Affordable Care Act has supported the growth of good jobs in low-income communities. I cannot stress enough how important it is actually offer the opportunity to give our folks quality jobs as well as contributing to the tax base of our communities. In conclusion, community health centers like Ultimate are proof that the Affordable Care Act works. Funds provided from the ACA have allowed Ultimate patients to increase health care access to additional patients geographically. They've increased patient access to care by providing additional clinic locations and enhancing their services. The American Health Care Act abandons our most vulnerable populations by rolling back foundational coverage programs like Medicaid and Medicare expansion. So today, together with the support of community members like Assemblymember Mike Gipson, we can eliminate health disparities in underserved communities and continue to provide quality care without exception. So thank you once again for your support, and we're definitely here to stand by you. Thank you.
Cal State University, Dominguez Hills.
My name is Justin Blakely. I'm a student at Cal State Dominguez Hills, also a representative of ASI, as Director of Legislative Affairs. I just want to say, as a millennial, as someone who is actually being affected by this, what the Speaker of the House is planning on doing to take away the Affordable Care Act, I know individuals who've actually been recipients of the Affordable Care Act, and how there's been some people that I know that have had a disease or something that they're using currently to get the treatment for it, and because of this is going to affect their lives. And so, and that's someone personally within my family that I know that definitely benefits from this, and that has a low income in terms of what she's paying for. So, as a millennial, as someone who does benefit from it, who knows people who are benefit from it, this is an extreme detriment to our community, the people in my family, and I mean just people in general. So as a student, as someone who doesn't have a career, not in their career yet, I would just urge the Speaker, our administration on the federal level to definitely not repeal Obamacare.
Thank you very much. Thank you. We have a representative from Charles Drew University.
Well, at Charles R. Drew University, our mission is really to increase the number of primary care providers and to increase access in areas like Service Planning Area 6. So we feel like any sort of repeal of the ACA is a huge setback for communities like SPA 6, and particularly for communities that lack access to healthcare services. Latino, African American, Asian communities, Californians at large, we really feel like this would be a huge setback. And to deny people access to care, to repeal provisions of the current ACA, also known as Obamacare, that would eliminate access for those with pre-existing conditions, etc. it's deplorable. And as Americans, I really feel like we should stand tall and stand up and continue to realize the access and provide insurance for communities of color as well as all communities. Thank you.
Thank you very much. Thank you very much. Let us be clear. Today is a day of call to action. It is not by accident we stand here by Martin King Hospital, Charles Drew University of Medicine and Science, or Augustus Hawkins, and also Oasis Clinic. This community will be hit the hardest, and it's important that Congress get it. And so I'm asking each and every one of you to please stand with us. We're asking you to please call your member of Congress and please express to your member of Congress why the ACA is important to your family, to you, and to all Americans. And so again, we will continue this fight. We appreciate everyone who's come out and raised their voices with us in this particular endeavor. But the fight continues. We realize that Congress will be making a decision sometime next week, but we want them to hear our voices each and every day until they make a decision. And we hope the decision they make is that they will make the keeping the Affordable Care Act intact so that all Americans can live a healthier life. So thank you very much for coming. At this point in time, I will be giving Mr. Ryan a phone call. This is Mike Gipson. I'm a state assembly member in California representing the 64th District, and I'm also the chair of the Assembly Democratic Caucus. Yes. Yes, I understand. Yes, I'd like to leave a message. Would you please tell the Speaker that any disruption will be devastating to the people of the state of California and all Americans, and we need him to rethink his position in terms of repealing the Obamacare. Thank you. 310-324-6408. My cell phone number is 310-704-6589. You can call me direct. Thank you very much. Bye-bye. Okay. So we left a message with Mr. Speaker's, Ryan's office, encouraging him to, one, give me a call back, and also let him know I represent California. And so we encourage people to do likewise. So please keep up this fight. They need to hear your voices. One person can't do it. One call to action can't do it. It's going to take all of us collectively to raise our voice and also send a strong message to Washington, D.C. We're not going down without a fight. So thank you very much for coming. Thank you.